So, um, I'll try to keep this for 5 minutes. My name is Robert Gregg. I'm a long-term patient at the Montreal Chest Institute. I've been here since 2000. I have COPD. I was born with arthrogryposis, a severe deformity of my spine, all my limbs, lack of muscle tissue, and certain parts of my anatomy. Like many birth defective babies, I wasn't given 6 months to live. Later, they pushed it off to 3 years. Then they pushed it off to 15 years old. And I'm 62 years old. And if I was to value my life in the hands of today's experts who are concerned about overpopulation of the world and quality of life, I would not rank very good. And what really bothers me right now is for 20 years, I was able to do anything I wanted to do, go anywhere I wanted to go. I worked in different countries for 20 years, and no problems except a few gastrointestinal hemorrhages. And I was one of these guys that I never wanted anything to do with the medical system unless I had to. So that was the way I lived my life. And since 20 years ago, I had respiratory failures, and I lived with COPD. Now, in all the jurisdictions where euthanasia, assisted suicide, are legalized, I rank as one of the incurables. Bill-52 in Quebec is a no-no. And I don't care how many people want to die with dignity. You cannot die with dignity when the right to die with dignity means a right equals a law. I never even understood that until recently, that rights are laws. So I'm a little bit naive, but I've been involved with the anti-euthanasia movement for quite a few years now, and I would like to say this. Dr. Lowe, it's great he was a microbiologist. It's sad that he had to die, but we all die sometime. And I'm going to croak, and everybody around me is going to croak, and you're going to croak out there. But I do not like this continual ranting and raving and parading for more debates and more campaigns to legalize euthanasia. We do not need euthanasia. Yves Tribert was the first guy who started saying in 2010 that, hey, now everybody knows it's going on anyway, so now we need a law to catch the bad guys. That wasn't a good idea, because everybody knows what happens when the laws are passed. There's no intention to enforce safeguards, no intentions in any of the campaigns which eventually wound up the laws being passed. None of them. And Quebec is just another one of those places. And I would like to strike down any more campaigns and block any laws in this country. This is Canada. We don't need euthanasia and assisted suicide. Not in this country. That's the end of my statement.